Hey there, and welcome back, or welcome for the first time if you're a newcomer to our channel. I'm Jennifer Ellis Schutz, founder of Wellness Code Academy, where we provide holistic, trauma-informed training programs for progressive wellness professionals seeking to learn a more dynamic, standout healing approach that goes beyond the standard protocol model. This said, when it comes to healing chronic gut issues, the most common factors to consider, identify, and address includes things like food intolerances, dysbiosis, leaky gut, small intestinal bacteria overgrowth, otherwise known as SIBO, toxins such as mold, parasites, and other gut-centered stressors. These are all huge core drivers of chronic gut issues, and so they definitely need to be adequately identified and addressed. But what happens when all of the best healing interventional strategies, along with top-notch client compliance and a great healing mindset, not only don't help to improve symptoms, but symptoms get progressively worse with each passing week, and new symptoms, especially neurological ones, develop? In this scenario, we need to adapt and think more expansively and systematically. In this week's video, When Gut Issues Happen Outside the Gut, Sarah and I are going to explore this exact topic as we walk you through one of my client cases as well as my own personal case. Be sure to stick around till the end because we are dropping wisdom bombs galore that all self-healers and wellness professionals need to know. Let's dig in.
Hi there, and I'm Sarah Korzeniewski, Jen's partner here at Wellness Code Academy. And I have learned so much from Jen. She's been one of my best mentors that I've ever had in my own journey to become a trauma-informed, functional, transformational coach. And so we are excited to discuss when gut issues are outside of the gut. So, Jen, tell me about this client who you and I have talked about quite a bit, who's made this breakthrough discovery about issues outside the gut that are driving gut issues themselves.
Yeah, great question. So for protection of my client's privacy, we're going to call her Hannah. And Hannah came to me approximately about 3 years ago, maybe a little longer. She had been really struggling with a continued spiral downward of horrific, unrelenting gut symptoms that prior to me, she had kind of run the standard functional medicine gamut of seeing practitioners, them running GI maps, SIBO breath tests, other tests, and then creating mostly supplement protocols to deal with the findings, maybe H. pylori popping up, dysbiotic gut bugs popping up, SIBO protocols, some dietary changes, and so forth. Yet she just didn't respond to any of it, despite monumental efforts and compliance on her part. And this was all her issues started really unfolding at the onset of the pandemic, but then kicked up several notches after she got the wonderful COVID-19 vaccination to protect her from the supposed globally deadly virus that we were all faced with. And she came to me to help her sort her issues out. And right away, upon looking at her history, the consideration that she did get worse after the vaccine and that she had not responded to any interventions whatsoever, she was getting progressively worse. I knew, despite what she believed, that her gut issues were much bigger than simply a case of SIBO that needed yet another antimicrobial protocol and another GI map. I could tell, I could just intuitively feel it. And so the investigation began. And the first lab that I order on all of my clients is a HTMA, hair tissue mineral analysis, and I interpret it as we teach it here at Wellness Code Academy in our holistic HTMA Pro program through the lens of accumulated stress and trauma. And her HTMA showed me the most profound case of four lows that I had ever seen, but not just four lows. All of her minerals were the lowest I had ever seen anybody's mineral test in my 13, 14 years of doing this. And her toxic elements ratios were all super low, which we'd want them as high as possible because when the ratios between minerals and toxic elements are super low, it means there's more toxic elements in the body than there are nutritional minerals. So I knew that she had a huge toxic burden. Her body was stressed out. I'm talking hanging on by the skin of her teeth. And um, that combined with Wellness Code energy testing, which is our proprietary system that we created here at Wellness Code Academy, pointed me in the direction of recommending her to get a full body thermography because I wanted to see where the inflammation patterns were in her body and where there was a reduction in vascular flow, the flow of blood and oxygen and resources that we need to go through the body in order to run our bodily systems. So between HTMA, the energy testing that I did, and the full body thermography, it became very obvious to me that her unrelenting gut issues were not stemming from her gut, but rather her chest area, her neck, and her brain. And why do I say that? Because the thermography didn't show hardly any inflammation in the gut area, nor did any of her conventional medical radiological studies like CT scans, endoscopies, colonoscopies, upper GI studies. They couldn't really find, not couldn't really, did not find anything remarkable on all of those studies. Yet her thermography, boom, bright red in the neck, the upper chest, and the brain. And I was like, all right, these gut issues are not in the gut. They're stemming from the neck. Something to do with the brain function, the vascular system, something. And at that point, I didn't know what, but I knew that I needed to point her in additional directions and that we needed to bring on other team members. So that's my answer to that question, Sarah.
Yeah, and so it sounds like the standard functional medicine approach really failed her because you mentioned, running a lot of labs, taking a lot of supplements, and a lot of times that made her worse. And I remember in our conversations that you did mention that she did try some of the more psychological or, the more nervous system regulation side of things as well, which didn't lead to solutions either. Can you mention that a little bit?
Well, yeah, I mean, my functional medicine, or I like to call it transformational medicine approach, is very, it's very much rooted in a combination of physiology and psychology. I have a strong background in counseling and psychology, so I bring that to the table. And first and foremost, she had been doing a ton of mental and emotional work. She had been heavily involved with a yoga studio that was working deeply with her on the concepts of surrender, relaxing into pain, exploring previous programming that's no longer serving her from her family of origin and so forth. You know, like all the typical breath work exercises, tapping exercises, and so forth. And then we even continued that and went deeper, and I was bringing a lot of transformational coaching techniques to the table. And so we were definitely doing that. I got her started on some additional breathwork strategies and posture strategies, but it was clear that like nothing was putting a dent, and her psychological stress was going up, 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 up because her symptoms were getting worse. This woman was literally fighting against severe pain. And I know what that is like firsthand because that was the story of my life. And everybody in kind of the brain retraining community just kept telling me that I needed to surrender more and that it was totally just because my limbic system was caught in a limbic system trauma loop. And I'm all about that. However, I know my body better than anybody else. And I knew that there were bigger physiological fish to fry that needed some uh, intensive interventions that no amount of brain retraining or meditation or positive affirmations or surrender was going to resolve. And I knew it. So I could relate on a deep, personal, visceral level to this client. Okay. And what was your question again, Sarah? Because I think I got a little off track.
Well, I was just more, I remember you talking about her also seeing and working with the trauma aspect, but like that experience actually kind of led to more trauma.
Oh, yeah, yeah, yeah. So that's the yoga studio situation. It did because she was doing all the things, all the things that this yoga studio was guiding her on, but she was getting worse. And when she came to me, she said, I just intuitively knew that I needed a different level of intervention. Not that I didn't need that, but I needed something in addition to that. And she felt that when she brought that to them, they kind of not kind of, totally gaslit her and made her feel very shameful that she wasn't surrendering enough, wasn't embracing or embodying the mental and emotional healing components of her journey enough. And that in itself became another trauma for her because she had given them an immense amount of her trust and she was like depending on them to guide her, and she had looked up to them and she felt utterly betrayed by them. So by the time she came to me, she was like trauma on top of trauma on top of trauma with this immense physiological horrific pain, and we had to unweave all of that. And yes, she had seen several different holistic functional practitioners before me that, like I had said, they'd run the GI maps, done the SIBO breath test, done the protocols, supported the adrenals with adaptogenics, taken the antimicrobial herbs and antiparasitic herbs and so forth. And she was just getting worse and worse and worse and worse. And then she would try another functional practitioner, and what would they do? They would start the same thing, run the same labs, and just create a different protocol. So it was lab test and protocol chaos.
Oh yeah, and we know protocols are not the solution, uh, or largely the solution. So you've mentioned that you did the HTMA, you did the energy testing and the full body thermography, and you noticed that she had more of the, inflammation or whatever more in her head area. So what was kind of the next step to figuring out what this was and how it could ultimately be affecting her gut health and just her overall health?
Yeah, great question. So just to clarify, I didn't run the thermography myself. I'm not a thermography practitioner. Of course, I had to point her in the direction of getting a full body thermography from a local practitioner. The investigations that I had run were the HTMA, hair tissue mineral analysis, and then energy testing. And we had done some others, but it's really moot point. Some other lab tests, but it's kind of moot point, and I don't even want to take up time mentioning because they didn't reveal any useful data. It was really the combination of the HTMA, the energy testing, and the thermography, which she got with another practitioner at a local establishment in the area in which she lives. And yes, it showed inflammation basically from the upper chest up to the top of her head. And as I had mentioned earlier, at first I was like, what does this mean? Okay. But continued energy testing kept bringing me in the direction of structure. Something was wrong with her structure. Okay. And this was like over and over, and nervous system overwhelm, but first and foremost, structure. So something in her structure, in her biomechanics, in her musculature, in her bone structure was driving immense nervous system dysregulation that, like I said, no amount of like mental and emotional work or nervous system regulation tools like the tapping that I mentioned or the meditation and so forth was going to touch. And I knew that. So I put my thinking cap on, and this particular client, Hannah, she has occupied an immense amount of my mental and emotional bandwidth because I don't like not being able to help clients crack cases, and I don't like to see people suffer. So when I wasn't working with her, I was thinking about her case. And so I started to research, factors in the head and neck area that could cause horrific, unrelenting gut issues that don't respond to anything. And that led me to learning about a situation called craniocervical instability, where the ligaments in the neck become too laxed and they lose their ability to support the structure of the head sitting on the spine. And so that was one aspect, but then it brought me into learning about another aspect called stylojugular venous compression, which can happen as a result of craniocervical instability. All human beings have like these small bony structures on either side of the cervical spine called styloids. Everybody has them, okay? We're born with them, but they should be under a certain limit. Like I'm not quite sure what the minimum limit or maximum limit is, but they should be under 3.3 or 3.0 centimeters. Okay, maybe some websites say shorter than that, and they should only be like a certain circumference and thickness and so forth. However, when these styloids grow and they get thicker and more dense and they become elongated, they can actually act sort of like bone spurs. And they'll do this as a compensatory mechanism in the body as a result, as one factor. There's other factors, okay? They can grow long and thickened as a result of craniocervical instability in order to better hold the head in place on top of the spine. And in the process of growing fatter and longer, they can impinge the venous system in terms of the jugular vein and the carotid artery, which our venous system in our neck is a significant component of how the brain detoxes. Okay, so if there is compression in the venous and arterial system, the brain cannot detox adequately. So now we are at risk of developing a situation known as toilet brain syndrome, where literally like toxic fluid backs up into the brain. And when this happens, all heck breaks loose, really, because it disrupts the communication between the brain and the body. And it can also inflame the vagus nerve, which we know is like the bilateral or bidirectional information highway between the brain and the gut. So it's a big deal. It's a huge deal. So and I was like reading about all of the symptoms. And by the way, when these styloids grow like this, there's actually a term for it, and it's called Eagle syndrome. But there can be various degrees of Eagle syndrome with stylojugular venous compression being definitely a pretty serious level of Eagle syndrome because it's compressing on the internal jugular veins and possibly the carotid artery, putting one at risk for blood clots and strokes and things like this. So it's a big deal. But more importantly, it's completely disrupting the overall function of every bodily system in the body, with the gut being one of the big ones that it gets hit in many people. And her symptoms were like, boom, this described. I was like, and just thinking about what I saw in the HTMA, what energy testing said, and then more importantly, what her thermography showed, I'm like, okay, she needs to go see this doctor who I learned about all this from, which is Dr. Ross Hauser at Caring Medical, who used to be based here in the Chicagoland area, my neck of the woods, but at some point he migrated to sunny Florida, and his clinic is still called Caring Medical. So I compiled all this information and I condensed it in client friendly language to present to her because that's my job as a functional health practitioner and transformational coach. When I realized the need to refer people to other professionals, part of my job is to condense information and put it in client friendly terms. And I did, and she was like, oh my goodness, I totally agree with you. She watched some of Dr. Hauser's videos, and the next thing, she was buying plane tickets and on her way to sunny Florida to have this full on investigation by Dr. Ross Hauser at Caring Medical.
Yeah, so interesting. So what is kind of the next step? Like how can somebody get this identified?
Yeah,
Like
so
what
great
do you need?
question. So, first off, she was diagnosed with the severe stylo jugular venous compression because she had bilateral, elongated, and thickened and calcified styloids on both sides that showed clear and obvious compression of her internal jugular vein. And this was done, this was confirmed with a CT venogram of the neck, so CT venogram, but it can also be confirmed if you can't get a CT venogram, you can do a CT of the neck without and with contrast if specifying that you need to evaluate for elongated styloid processes with venous compression. So it was those CT scans, and then she also did a digital motion X-ray study to evaluate um, the compression under dynamic movement. So, like if the compression got better or worse when she, tipped her neck back to the side and so forth, because they need to see the compression from all angles. And and it was also confirmed through these studies. He did another study, or maybe it was the digital motion X-ray. I can't remember, but it was those two studies that helped confirm the compression. And I'm not quite sure if there was a third study to confirm that she had the craniocervical instability. So part of resolving this issue is resolving the craniocervical instability, which involves strengthening the ligaments. But you can't even do that until you first remove the styloids and alleviate the jugular compression. After that is done, then you can start working on alleviate or treating the ligament weakening or the weakening of the ligaments.
Okay, and then you mentioned that this then, of course, brought light to your own healing journey. So talk about how this situation impacted your own discovery for yourself.
Yeah, so I'm going to do my best to condense this because my story is literally, she could fill a whole library. But long story short, I've got my own long, hellish, precarious health history that started at the onset of my career as a high school public school teacher. Okay, I was a Spanish teacher, head girls varsity soccer coach, and it started long ago. And it evolved through many different paths: chronic Lyme, chronic fatigue syndrome, myalgic encephalomyelitis, mold illness, yada, 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 yada. And I saw many different practitioners. And it kind of came to a culmination, everything in 2011 when I had to undergo a radical liver resection surgery to remove a massive calcified cyst that was caused by a parasitic infestation that had gone undiagnosed for likely upwards of 14 years. And this thing was the size of like a cantaloupe, and it was encroaching on my common bile duct, and it had caused my gallbladder to go necrotic and so forth. So I had to undergo this surgery to have this cyst removed because there was no amount of detoxing this cyst, no amount of antiparasitics that was, I had tried everything. It needed to be surgically excised. And I got that done. And after that surgery, I started to experience pretty severe gut issues, but not as severe as they were going to become in the next couple years. And I never really fully recovered from that liver resection surgery because it was just such a huge insult to my system. I mean, they had to cut me from basically the pelvis all the way up past the sternum. My ribs had to get broken. I developed all sorts of post-surgical complications with a large bleeding duodenal ulcer being one of them. And it was just like kind of a shit show. And so my system was already taxed going into that surgery. And now it was further taxed trying to recover, maintain my teaching career, deal with life, and so forth. And because of that, my immune system was super weakened, and my elderly mother contracted a an intestinal infection with Clostridium difficile, C. diff, that just about took her out, landed her in intensive care, and I was one of her primary caregivers during the time. And I contracted C. diff, like a horrible case that resulted in me needing fecal microbiota transplant therapy to ultimately resolve. And then on top of that, my husband and I got hit with salmonella food poisoning. He recovered within 3 days, and I never recovered. So between the liver resection, the C. diff, and the food poisoning, my I developed this horrific gut issue. No words to explain it, but along definitely as severe, if not more severe, as my client Hannah that I just described to you. All of the above, and with each passing year, I lost more and more ability to tolerate more and more foods to the point where I needed to go 100% carnivore. I did a 100% carnivore version of the GAPS diet, which basically saved my life, and so forth. And during this time, I sought a lot of different opinions of different experts, both in the conventional setting and the holistic setting. And through various investigations, it was determined that I had pretty significant nerve damage to my small bowel. And they concluded that it was likely from the surgery because it was open abdominal, and that I was just going to have to learn how to manage it. Wonderful, right? Which the no plant gaps diet and carnivore has played a significant role. In fact, if it wasn't for those in that intervention, that dietary intervention, I wouldn't be alive and well enough to be doing this interview right now or running the coaching practice and wellness code academy that I do. So I really 100% attribute my current level of health to that. However, the issue never resolved, and over the years, I have developed more and more neurological issues and also experienced the inability to bring plant foods back into my diet on any kind of sustainable level. Like I can eat them at a minimal and for, maybe up to 10 days, but then the gut starts getting re-inflamed again and just exacerbating the stress and inflammation cycle. So then I'll have to go back to carnivore to kind of reset it. And I know that that's not normal. Okay. And I don't feel that anybody should have to eat a carnivore diet for the rest of their life just to maintain stable health. There's a bigger situation being missed, in my opinion. But on top of that, especially this last year, I've just been experiencing more and more strange neurological symptoms, like a sensation that someone's putting like a sword down my throat and into the upper part of my gut, stabbing like lightning bolt pains that kind of start in the right suboccipital area and go down, shoot down the right side of my body. Horrific, like chest burning pain, as if like a volcano is erupting in my chest. As part of my medical investigations, I was told that I had severe chronic bile reflux, which is very common with people. Not super common, but it's a rather common complication of gallbladder removal surgery, especially when there's liver resection involved. So I was told, you're just going to have to manage this bile reflux for life. And I'm like thinking, oh God, great. I've got all these like permanent damages to my body that I'm going to have to manage for life. But in the more recent months, it's gotten even more severe with like numbness and tingling in my right arm, periods of dizziness. But the most concerning one is I've been experiencing these like severe pressure headaches where my brain feels like it's been swelling against my skull. So like severe intracranial like tension, like just like pressure in my head, and episodes where I don't feel stable enough to drive. And you know, in my line of work, I know that when the body is not given what it needs or it has a message to communicate, it will continue to scream louder and louder and louder until we hear it. And that is what my body was doing. But yet I was kind of keeping symptoms at bay with all the amazing tools that I know: nutrition, lifestyle, nervous system work, mental and emotional healing, all of the things. And I am like impeccable with them. But no matter how impeccable I've been, the body has been speaking to me. And to make a long story short, I need to backtrack a little and mention that when I was in high school, I was in gymnastics and I had been hooked up to a buoyancy harness, which makes you more buoyant so that you can learn how to do specific stunts until you can do them on your own. And I was in a buoyancy harness and it wasn't hooked up properly in the ceiling. And while I was mid-air, it came undone and it dropped me on my head, literally compressing my head into my spine and causing a compression fracture in my thoracic spine, which I needed to have surgery to remove a large lipoma tumor that had formed around the injury. Okay, so I have that history. And one of the ways that we can develop craniocervical instability and grow these styloids is with a blunt force trauma to the head. Well, I would say that that classifies as a blunt force trauma. So in considering my client Hannah's case, I started to, put together pieces of mind going, maybe this is what I could have going on too, driving these continually worsening neurological issues and this like burning chest pain and this horrific bile reflux. So recently, I underwent the CT scans that I had mentioned, and lo and behold, bada bing, what do I have? But I have elongated styloids, bilateral, that are showing not just obvious, but significant, severe, obvious compression of my internal jugular vein and compression of my vagus nerve. So, yeah. So that's how it relates to my case. So, um, my story is to be continued, but I know for certain that this has been playing a role in my ability to achieve the top notch optimal health that I have been seeking, but have not been able to secure yet. I've come so far, I've done a lot of healing, but this is clearly another layer and piece of my puzzle.
Amazing. Yeah, thanks for sharing all that. So you mentioned the blunt trauma to the head. Are there other things that can contribute to this?
Of course. So we've got the blunt force trauma to the head. Another thing that can contribute to it is just overall poor postural patterns. A life of looking down at devices, particularly cell phones, that puts a reverse curve in the cervical spine, which can then start to trigger the process of craniocervical instability, chronic inflammation. So if you've got a dysbiotic gut that is brewing inflammation from the gut, then we all know that what happens in the gut doesn't stay in the gut. It's going to leak across a the intestinal wall into the humoral blood supply, where it's going to trigger the immune system in action. And eventually that's going to impact the vagus nerve and the brain. And so it's just going to be a chronic inflammatory cycle, and chronic inflammation can cause bone structures to grow abnormally. Some of it can also be genetic, but we here at Wellness Code Academy don't believe that genetics are our destiny. However, we all have warehouses of genetic potential that if we encounter enough environmental stressors, those genes can get flipped on, which is technically the saying, genetic loads the gun, but environment pulls the trigger. And also, I would say part of those environmental inputs can be long term sustained mental and emotional distress for those coming in with a history of complex trauma, which I was the poster child of that too. So I could probably check all of the boxes for myself as the factors that can contribute to stylo jugular venous compression and craniocervical instability.
Okay, great. Yeah. So, what do you feel is important for practitioners, but also for self-healers, like to take away from this? What do you think that they need to know most, about this particular situation?
Well, first and foremost, as I said in the introduction to this video, that when it comes to gut issues, we have to not automatically think that they're coming from the gut. Of course, that's where we start. However, we need to really approach all healing, not just gut healing, from a trauma informed systems approach. We have to consider the role of every other bodily system and the interrelatedness between us and our environment in the development of a chronic illness or disease process that is showing up in one system, and in this case, the gut, which clearly it wasn't being driven from the gut, it was being driven from elsewhere. So the key takeaway here is that with any chronic health issue, we need to think in terms of systems and the interrelatedness between them, and remind ourselves that symptoms in one area might be being caused by factors in a far off area. And so we really need, that's a whole body, whole person approach. So incredibly important. And also, when a client says that they are getting progressively worse, we cannot automatically jump to the conclusion that there's lack of compliance or that they're not surrendering enough to the mental and emotional part of the healing process, and that they need just more brain retraining. That is like a huge no for me, because I was so traumatized by that myself. And I've seen many practitioners kind of do that, or allude to the fact that it's a mindset issue. They're embracing a victim mindset. Now, don't get me wrong. There are people that do embrace a victim mindset. So I'm not saying that doesn't exist. However, we have to be very careful when approaching these super complex situations, and be willing to put ourselves in that person's shoes and imagine how we would be responding, and how we would want the person guiding us to respond to us.
For sure, for sure. It's not just a matter of, oh, maybe they haven't killed enough gut bugs yet.
Which is a very common practice, right? We've got another layer of gut bugs to kill. Come on now.
Yeah,
When layers of gut bugs just keep coming up, I can tell you that the bugs are not the issue. They are a symptom of the issue. And we have to be humble enough to step back and know when and how to recruit other professionals and point our clients in the right direction. We cannot take on this expert godlike complex and ego-driven complex, thinking that our approach and how we work with clients is the only thing that they need. It,
Hmm.
it is a multidisciplinary journey. And we are one component of that. Now, granted, a huge component. In the case of my client Hannah, I have served as her beacon, her lighthouse, and her quarterback. I have been the one pointing her in these directions, helping her navigate the journey, helping her become informed, and presenting her with the pros and cons of each decision and helping her understand the consequences of each decision and where to go next. That has been my role. And I'm not tooting my own horn, but it's been the most pivotal role because without the skill set that I brought to the table and my knowledge and my trauma informed systems thinking skills, we would have never have led we would have never have been led to these discoveries. Truly, we wouldn't have been, because many of the practitioners I referred her to weren't even aware of this stylo jugular venous compression situation or craniocervical instability and the role that it plays in digestive dysfunction that doesn't respond to anything.
Yeah, so for wellness professionals that are listening to this, and I'm assuming vast majority of them will not know about this, what advice do you have for them about how they might be able to guide their clients? I would say for number one, just from like a foundational view of, maybe, talking about posture, those types of things, and also maybe if they suspect something like this might be going on.
So great question. So first and foremost, watching this video, becoming informed that it exists and the massive impact that it not can, but will have on the digestive system and every other system in the body, particularly the nervous system. So knowledge, awareness around it, because without knowledge and awareness, we can't even go to the next step. And then, like I've already said, humility, not coming to the table as the expert and thinking that you have all the answers and being willing to admit that how you work and what you have to offer might not be all that a client needs. And you're going to need great research capacity, great critical thinking skills, uh, great question asking skills, because we can't arrive at good solutions unless we ask the right questions. But asking the right questions now circles back to having the knowledge and awareness and being a systems thinker. And then, of course, presenting your findings in a way that informs your client, not to diagnose them because we cannot diagnose medical conditions, but as a way to help them come to the conclusion that yes, this is likely something that is impacting me because of reasons X, Y, and Z. And then our role is to help them find the other wellness professionals that they are going to need in their investigative and interventional journey. So it's sort of like a project manager, really. It's a project manager, and we need to think in terms of being a project manager.
Yeah, and even just teaching them the foundational things like talking about posture, like we teach,
Huge.
the mothers of all medicines in holistic HTMA Pro that people don't consider as being a factor that tells the nervous system whether it's safe or not.
Oh, 100%. I mean, this whole time that I have been helping Hannah navigate this tsunami of a health issue, we've been totally dialing in on the eight mothers of all medicine: nutrition, sunlight, sleep, rest, posture, optimal functional breathing, and all of those things. And we're doing the mental and emotional work alongside of this, because had we not been doing all of this, she wouldn't be, I don't she might not even be alive right now. So this has been propping her up while we work to, get to the bigger issues that need to be addressed. And it all takes time, getting appointments with specialists and getting in for surgical interventions and so forth takes time. And the work that you do while you're waiting for all of these things to happen paves the way for the efficacy of the interventions to even help heal the body. So it's everything. And nutrition has been a core component for my client Hannah. But like I said, it was a core component for me. Had it not been for the no plant gaps and carnivore diet, I likely would not be alive because my digestive system lost all ability to digest anything that grew from the ground. And anytime I did, it was just a matter of time before I had like an eruption of inflammation blow up in my small bowel that then just went up to the brain and the vagus nerve and caused more inflammation and stress on top of the inflammation and stress that was already there due to the vascular compression. So it becomes this like chaotic bidirectional issue, vicious cycle.
Yeah. So I know you've kind of already mentioned a few of the symptoms that someone might be experiencing if they have this issue, but can we just provide people with a little bit of a list here of what are some of the signs to be aware of that this might be a factor?
Yeah, so you can look this up on the internet and you'll come probably find a more thorough list than I'm providing here because I don't have any notes in front of me. But it I want to first emphasize that some people might not have any gut involvement. Not everybody gets gut involvement, but the people that do get the gut involvement, they get it hardcore, and it's bad. Um, so there's that. But pain in the neck, pain with swallowing, pain in the ears, the head pressure type of headaches, numbing and tingling in the limbs, episodes of dizziness. Mast cell activation syndrome can be a product of this due to the venous congestion that can happen in the brain and the disruption between the gut brain axis and the further disruption of the digestive process. So mast cell activation syndrome. I mean, it really goes on and on because when the gut brain axis becomes compromised due to this vascular compression, really it's anything could pop up, anything and everything. The nerve pain in the face, chest pain that makes you feel like you're having a heart attack. I've had that. Uh, Horrific GERD, gastrointestinal reflux situations that don't respond to anything. So despite like even taking antacids, it just keeps coming. Bile reflux, possibly even in the absence of not having one's gallbladder removed. So a wide array, but I would say most importantly, like if you're doing all of the interventions to help a person heal and nothing's touching them, like nothing is working, that's when we really have to say, okay, what could be going on here that my investigations can't confirm 100%.
Yeah, and we talked a little bit about this the other day, and you even mentioned like worsening HTMA patterns. Like you're running HTMAs and doing all the things, but the patterns and the like it keeps looking worse.
Yes, and that was the case with my client Hannah. Like every single HTMA, it was worse. And despite this client of mine is the antithesis of non-compliant. She is the most compliant, most dedicated, most organized person that I have ever met. Okay, so it didn't. And when we would come up with a plan that we would co-create together, she was on it. Okay, she wouldn't wait a day to get started. Like the minute we would get off our session, she was taking action and doing it. And we were checking in regularly through messaging, and it didn't matter what we did. She continued to get worse and worse. Now, I will need to remind you again that and this would be another video all in itself, but we have huge evidence that vaccine injury is a large part of her issues that have further complicated the venous compression. And so I'm not going to get into that, but that's a huge component of hers that needs to be dealt with also. But she is in such a reactive state right now due to such bad venous congestion that she can't tolerate like literally anything. Her body is like in FU mode to everything. So, yeah, one step at a time. We really need to get this venous congestion resolved in her.
Yeah, and this would be a good reminder to anyone listening that we do have a post-viral wellness solutions course that we'll drop the links down underneath this video if they want to check out some solutions for vaccine injuries or long haulers issues.
100%. And we can end with me saying that if you want to learn a truly trauma-informed systems thinking approach, which is what led me to leading my client to finding her issues and on the path to resolving them, and myself, we teach this in our holistic HTMA Pro Practitioner Certification program, which teaches the interpretation and implementation of hair tissue mineral analysis through the lens of accumulated stress, trauma, and transformational coaching, and how to then link that to other factors that you need to bring in for a truly whole person, whole body approach.
Great, yeah. And last question to wrap things up is what advice would you give to someone who might be facing this situation?
Boy, um, so much to say about that. Number one, um, I know the hopelessness and despair that can come with this. Um, don't give up when you're feeling hopeless and you're despairing that nothing works for you and that there are no answers. There are answers. So the operative word is yet. So really focus on that word yet. You haven't found your answers yet. You haven't found the people to help you navigate your journey yet, but you will if you never give up and continue to take consistent, intentional action forward. Huge, another, huge one is you truly do need to dial in on the fundamentals, the nutrition, the hydration, the sleep, the rest, the breathing, the posture, the daily movement. Because, like I said earlier, it's those things that have kept me alive and in the best health that I can be in, despite this vascular compression, but also my client Hannah. And those are the things that will prepare you for any deeper level intervention that you might need if you have this going on. And also, you as the self healers out there, but as well as the practitioners, again, you need to be a systems thinker. You have to think big picture and not hyper focus on what are the bugs and the toxins making me sick. Because typically, if we're overrun by bugs and toxins, those are symptoms of bigger issues.
Well said. All right, thanks everyone for watching. We'll see you next time.
Yep.